Welcome to Ask a Black Doctor. My name is Jasiri X. I am the co-founder and CEO of One Hood Media, and I'm happy again to bring us another edition of Ask a Black Doctor. For those that maybe if this is your first time watching or haven't seen the show before, my Ask a Black Doctor came about in May of 2020. It was kind of a spinoff, of our other television show, but it was a spinoff of our town hall, What Black Pittsburgh Needs to Know, which started out as What Black Pittsburgh Needs to Know about COVID-19. And so, Gateway Medical Society contacted us and said, hey, we have a group of Black doctors and nurses and health professionals that we would like to make sure had a conversation with our community. Of course, now we know, that COVID-19 specifically has disproportionately affected, our community and really highlighted a lot of the institutional and structural racism that we see. And so we're thankful that Gateway Medical Society reached out. So we started with Ask a Black Doctor about COVID-19. We went into some other issues. We went into colon cancer. We went into addiction. We went into obesity and health. But, we're still in the midst of a global pandemic, and it seems like, I don't know, it was like a 2-week stretch where we thought like, oh, we coming out. Y'all remember that 2 weeks, 2 weeks in the spring? And it's like, we're right back into it. And so, we to me, it's needed now more than ever. And so, I'm glad like we were able to this is actually a show that we did. And we had all these technical difficulties. I think this was the reason why we're actually on this platform called StreamYard. Shout out to Gary and John, our producers, because we were using another platform and it was terrible. And we had the incredible Issac sisters on, and we couldn't really get everybody's voice in, and it was terrible. So now we're bringing the famous Issac sisters back to Ask a Black Doctor. Definitely want to shout out to Mom Lisa. There's Mom in the chat. And she is also the president of Gateway Medical Society. So we thank you. I thank you for your vision and for producing really, I think ultimately to get into healthcare, to want to be a doctor is to want to be a servant of our community ultimately. And that service is needed now more than ever. So we have Dr. Lailah and Dr. Erin with us. Dr. Veronica will be joining us shortly. So we'll start with you, Lailah, if you just want to introduce yourself, say a little bit about your background in the field that you're in. Then we'll come to you, Erin, and then we'll the mighty Dr. Issacs. And then we'll get into some of the conversation around COVID, around kids, around sports, around when to go to the dentist, all those good things. And so if you all have any questions that's off top, if you have any questions, feel free to jump in the chat right now, ask these questions and we'll do our best to get to them before the show is over. So Lailah, what's up?
Hello, thanks for having us, Jasiri. I am Lailah Issac. I'm a sports medicine doctor, primarily trained in physiatry or physical medicine rehabilitation, and now practice doing sports medicine, so seeing people with musculoskeletal injuries, and then also a team physician for a university and a few high school teams as well. So importance of just physical activity, taking care of injuries, and health from that perspective, and then just playing sports safely during this time has kind of been a big focus in my day-to-day, and then that I'm happy to talk about.
Absolutely. Thank you very much. And Erin?
Hi, everybody. Again, thank you for having us, Jasiri. I'm the youngest of the Issac sisters, and I am located here in Pittsburgh. I'm a board-certified pediatric dentist. I practice in Shadyside. I own an office there. I also am an assistant clinical professor at the University of Pittsburgh. So everything I do is about teeth and baby teeth mostly, and I'm excited to answer any and all questions that you guys have about dentistry and how COVID mixes in with dentistry as well.
Absolutely. So I do want to start with you, Lailah, and this is just more so like, was it? I mean, because Pittsburgh is a very like sports. Was it like the Steelers and like what made you want to get into specifically sports medicine? Was it like the presence of the Steelers and the Penguins and the Pirates? Were you an athlete? What was it that was the field of medicine that sparked your interest?
Good question. So yes, I loved sports growing up, playing sports, and then I played soccer at University of Pittsburgh, and I remember seeing a doctor on the sideline a few times, like, why is a doctor out here? Like, just not knowing that other than athletic trainers and everything. So I had an interest in science and anatomy, musculoskeletal. So once I kind of decided on the path of medicine in general, I then thought about how do I get to sports medicine from being a physician, and just kind of worked that way for having to do residency in the summer, do that. So, but definitely I've always found it interesting about like injuries that people have. And even now still I'll watch. And if someone's on the injury report, I just want to know what's being done for them, how it happened. I'll replay sometimes when injuries happen just to see like what the mechanism was. It's just interesting to me, unfortunate, but interesting, and just how that can affect them. So it stemmed from, yes, being in Pittsburgh definitely was, I'm sure growing up there was a part of it, but then I also played sports and then having those interactions with people. And I'll say one thing is that when I played football for Pittsburgh Passion for one season after soccer, I hurt my finger, and I just kept playing. But then a doc was like, well, we can relocate your finger. You can go back out there. Probably not in your best interest, but yeah, relocate. Let's go. So we did that. But my follow-up after that was terrible. So now I have a ugly looking finger cosmetic wise and stuff like that. So I just found the importance of, that was something trivial, but the importance of the follow-up afterwards, because you have the adrenaline, want to get through what you're doing, but there's going to be follow-up there will be consequences later in life. So, but all of that to say, yes, growing up playing sports and being in Pittsburgh, that's a big part.
No, but that's important. I think a lot of people is kind of like, it's fixed. Oh, you fixed it. And like, I know me, I'm terrible at the follow-up game. So it's like, oh no, I'm good. I'm okay now. But like you said, like that follow-up sometimes can mean, in certain situations can mean life or death. So making sure that follow-up, those regular checkups are super important. How about you, Dr. Erin? What made you specifically want to go into dentistry as that was your field that you wanted to go into?
Yeah, so anyone who knew me or knows me from when I was a child, I actually wanted to be a veterinarian my entire life. Obviously, that did not happen.
I think that's like a lot of children, like, you like pets, you like animals.
Yeah,
it's like, I want to help
exactly.
animals.
Exactly. But it's really, really, but it's not hard to get into medical school, dental school. It is incredibly hard to get into med school. But so anyway, we have some family members who are dentists. I ended up just kind of going and shadowing them and hanging out with them at their offices and whatnot. I was like, oh, this is pretty cool. Same with Lailah, always had kind of like that science-y type of background. That's just kind of how all of us are. And a bit of a artsy and like to use my hands type of background, which works out well for dentistry. So after shadowing and whatnot, I applied to dental school, got in, and then around third or fourth year of dental school, it was actually our mother who was correct and said, I think you'd be really good at pediatric dentistry. And I was like, yeah, right, those little finger biters. But it actually turned out to be exactly, it's perfect. It's a perfect fit for me. I absolutely love what I do.
And they're not biting your fingers, or are they?
You learn to be very quick. There's only been 2 times ever that I've been bitten, knock on wood. One was a kiddo with special needs who didn't really know what he was doing. And the other was a day where I got like 2 hours of sleep and my reflexes were not good. So
Got you. No, but again, and I think like that's a field that's super important. I have a bunch of questions around pediatric dentistry as well, and I know Veronica is going to be joining us soon. But I did want to start with you, Lailah. I think because right now this kind of intersection between COVID and sports has been a big deal. It's been all over the news. You just had a situation. And I think probably like all the sports are happening right now, right? Like the NFL is happening, the NBA, the NHL, Major League Baseball, like this is that one time of the year where everything's happening. But you just had a situation where NFL coach couldn't coach the game because he got COVID. You have a situation where we were talking earlier where, certain places have vaccine mandates. The coach of the Washington State University basically declined to get a vaccine. He was fired. Of course, if you've been watching anything around Kyrie Irving, there's been this whole uproar of him not playing. So can you just talk a little bit about like, what do you see? Like, is it important? Is it more important because, you have particularly contact sports, football, basketball, hockey, folks are like pressing up against one another, sweat and everything. Like, is it more important in those sports that everybody is vaccinated? Does it matter if everybody's getting tested? Like, just from a doctor's perspective, like, how do you see right now, the fact that we're even playing sports might even to some people be kind of crazy because we kind of shut everything down. What's your take on just, playing sports during COVID and how best should we be protecting ourselves?
Mm-hmm. Initially, there was a lot of focus on the contact versus non-contact and what that may mean, at least at the similarly briefly at like the college level, about if certain contact levels mean that certain testing should be done more or surveillance testing and things like that be done more. Since the vaccine came out, there's less focus on necessarily how frequently those that are unvaccinated should be tested according to their sport, but just in general. Something to remember is a lot of times in college sports and really with sports, oftentimes when you're adult or definitely in college, you tend to spend a lot of time with your team or teammates anyway. So not only just when you're playing the sport, that may be one minuscule part of it, depending on if it's indoor or outdoor. But then also you just tend to spend more time with your team. So if it's something that's small and contained, but you're with your other teammates and it's spreading within your team, but then, you're a college athlete or then you're a part of society otherwise and have family, then it's getting out of there where it could have been, contained or could have been avoided or mitigated risk or those things. So I think but having the vaccine is super important. No, that doesn't mean that you're couldn't necessarily get sick, couldn't necessarily get COVID, but we're going to mitigate risks with that. And then more so, when that happens, it might not mean that a whole team needs to be shut down or a whole household may need to be shut down if some of them are vaccinated and not having symptoms versus if they're unvaccinated. So the other thing to remember about all of this is that COVID isn't some people have certain reactions, some people don't, some may be asymptomatic, some may not. And I won't quote specific, studies for that, but just relating to kind of the getting back to play after having COVID, it's not that it's just, okay, I'm going to pop up and go back to play. So depending on how old you are or what risk factors you have or what level, may need to see, and I strongly suggest that, see a physician to get clear to even go back to sports. So it's not just, okay, I had a runny nose, it's gone, I'm good. There may be respiratory or cardiovascular issues with that. We're seeing more and more that, there are certain symptoms that can come along with that we have to be more mindful of. But even if not following up, it's important that once I get back into activity, may have some trouble breathing or shortness of breath. Yes, it could be from deconditioning, but we also just need to be mindful that you're being watched and monitored for those things if those happen. So having that is just another layer of protection and mitigating and kind of helping other people out as well as yourself. But I do encourage playing sports and being active. So not everybody is a team sport type of person. Maybe you're an individual sport type of person. There's ways to do it safely. And I do encourage that, but knowing that just because I'm vaccinated, if I have symptoms, that doesn't mean I should necessarily go around with everybody and just say I'm vaccinated and be okay with that, being sick, but being around people. So
no, I think that was a great point. And just, one of the first NBA players that got COVID was a player on Minnesota's team named Carl Anthony Towns. And he actually talked about he had a panic attack like right after he came back to play. So I think we're also still in this place where we don't know what long-term effects or a lot of it, because this is so new. Somebody I know had got COVID, and similar to you, like said, like they tried to resume exercising and they had like a tightness in their chest. They had a difficulty breathing. So they had to like actually go back to the hospital to get that checked out. And so it's not, I think sometimes we have this, oh, I'll get COVID, I'll get better, and then I'll just go back to normal. And it's not that like simple one-to-one thing. And so it's important, but also, like you said, staying physically fit, staying active is something that, we probably should be doing anyway, but definitely like now more than ever to at least, help our system. So I know Dr. Veronica has joined us. If we could pull her in, hey. So we did the introductions. If you could just do an introduction, Veronica, about yourself, your background, your particular field of medicine, and then we can get rocking into the full discussion.
Sure. Sorry. I apologize. I forgot that tonight is a home Browns game, a night game. So, and apparently there's traffic when that happens.
That is true.
I hadn't experienced that until the 6th year I've been living here. So anyway, I apologize. I am currently living in Cleveland, and I am an adolescent medicine physician. So I primarily take care of teenagers and pediatric trained by background. So that's what I do. And part of that includes primary care. So I do deal with a lot of vaccination and stuff. So happy to talk about that in relation to flu and COVID and whatever else.
Absolutely. So I'm gonna get to you, but I want to come to you, Erin, because I think one of the things that you said you're specifically like pediatrics, a pediatric dentist.
Mm-hmm.
So like what, and I don't know how old. I don't want to shame the children that might have tried to chomp at you, but like, so what age, like, should we be looking at like, okay, this is the age that my child should start going to the dentist. This is the age that we really should be getting into like teeth care, flossing, all that stuff. What's the best time as parents that we should be doing that?
Yeah. So as far as, let's start with going to the dentist. As far as seeing a dentist, which I highly recommend if you're going to take your really little kids to the dentist, it should definitely be to a pediatric dentist. We just that's what we do. We love kids. We know different ways and methods to, get them to cooperate as much as they can at a young age. So that's the first thing. Age-wise, my office, we go by exactly the recommendations that American Academy of Pediatric Dentistry says, which is by age 1 or within 6 months of teeth coming in. So I've seen patients who literally have 4 teeth. The youngest child I saw was 2 or 3 days old, came straight from McGee because they were born with a tooth, which is not normal, but wow. Yeah. But just to say that if they have teeth in their mouth, they should be seeing a pediatric dentist. That's the easiest way to put it. Now, as far as oral care, that can actually start before they even have teeth. So I recommend using either like a washcloth or a piece of gauze and just kind of wiping their gums down. It helps to kind of desensitize kids to having something in their mouth. And then that way, when they do have teeth and you go into brush, they're already kind of used to having something in there. As far as brushing goes, true brushing starts when teeth come in. Parents can start out with like one of the little finger brushes, doesn't have to be an actual toothbrush. But then as kids get a little bit older, get more teeth in there, use an actual toothbrush. And toothpaste, I recommend starting to use around age 1, a fluoride toothpaste. And brush as best as you can twice a day with a little kid. That's all you can do.
Interesting. On a total side note, it's funny, it's like I happened to just see this TikTok of this guy who was talking about he was 20 years. I don't know if you get sent the dentist TikTok, but it was like things that you just learned. And he just learned not to swallow his toothpaste. and he was just saying how he was a child and he had the toothpaste that you can swallow. And he said when he moved to the regular toothpaste, I guess his parents did not pass on to him that he shouldn't have been swallowing it. So he got to 20. I guess somebody at 20 said, hey, bro, you probably should spit the toothpaste out. So it was just something that I saw and I thought was very funny. So we should make sure like we're spitting the toothpaste.
Yeah, that's a very good segue, Jasiri. I mean, so at age 1, start using a fluoride toothpaste just the size of a grain of rice. By age 3, you can use like a pea-sized amount, and then age 6 and up, they can use kind of like a peanut size. Even as adults, use way too much toothpaste. It shouldn't be swirlies like on the commercials. It's just one little streak. That's it. And I think you asked about flossing too. Flossing isn't age-based. It's pretty much if teeth are close together or touch, you should attempt to get some type of floss in between there. Food can get caught in between a 1-year-old's teeth just as much as they can in a 51-year-old's teeth. So that little kids use the little flossers, and that helps a lot.
No, thank you. Thank you for that information. So I want to come to you, Dr. Veronica. And, we already, Dr. Lailah kind of took us through the one end of like the COVID in the mainstream news, which was a lot of like the sports vaccine mandate. But the other big thing around COVID, particularly that happened recently, was, unfortunately, the death of Colin Powell. And they said he died of COVID complications. And I mean, I saw it, and it's weird how now, your social media becomes divided as to like people who are for vaccines or against vaccines. And so like the people who are against vaccines immediately was like, oh, but he was vaccinated. If he was vaccinated, why did he die of COVID complications? And then the people were saying, well, he actually had a rare blood cancer and that. So can you just shed some light around that? Because I think there's still folks that, obviously, it's your, and look, getting vaccinated is your personal decision. We're not here to go house to house bothering nobody. But what we are here to do is bring doctors that have studied medicine that, look like us. That, I mean, you all are like our community. You're like stars in Pittsburgh. You're the Isaac. Come on, know what it is. So we want to bring you all on. And you're relatable.
Stars for a different
and you all are relatable. So can you explain to somebody like that? And there was an article that I shared, you hadn't been on, but the Washington Post talked about breakthrough cases among Black people that we're looking and seeing now. Unfortunately, we're being disproportionately affected in some of these breakthrough cases. Can you talk about what like a breakthrough case means? And just the idea that just being vaccinated isn't an end all to be all, particularly if you're immune compromised, and just dispel some of those myths.
Yeah, sure. So actually, as soon as I saw the news, I immediately thought, oh my gosh, how am I going to start explaining why you still need to get a COVID vaccine? Even though you could still get COVID. I mean, I have been doing that, but now like Colin Powell, a well-known person, died from COVID complications after being fully vaccinated. I was like, oh boy. So yeah, the simple fact is that vaccines aren't 100%. They are one of the best tools we have in medicine, especially for COVID right now, because we don't really have anything else. We have antibody medications that are starting to be used, but they're really there are very strict guidelines around those, and they're needing to be used in people that are very, very sick. So it's not just like you get COVID and you have some mild symptoms and somebody's going to give you an antibody. So the vaccine is the best thing that we have, and it should help in most people if you would get exposed, to help make sure those symptoms wouldn't be so much that you would have to go to the hospital. Or if you did, hopefully it would be for some pretty mild supportive care, and not that you would need to be in the ICU on a ventilator, things like that. The reason why we are pushing so much for people with immunocompromising diseases, which happen to be a large proportionate of them happen to be in the Black community. So, or other underlying conditions that can compromise your general health, like high blood pressure, diabetes, some other respiratory issues, all of those things that put your body at a disadvantage when you get sick. And so in the case of Colin Powell, he had a blood cancer, and therefore his immune system was already low. And to try to fight off another illness on top with a immune system that's already compromised is very, very difficult. And it makes it hard to recover. And then on top of that, age and other things. So that's why you can see these breakthrough cases, but our hope is still that people don't get that sick. And what a breakthrough case means is that you are fully vaccinated, but you still get exposed and then actually become positive. And sometimes you don't get symptomatic. You might not be very symptomatic, or you could get pretty symptomatic. It really just depends on sort of the rest of your health history and that sort of thing. That makes you more at risk to maybe have other complications. So yes, we see this with a lot of things in medicine. That I will say that's probably one of the reasons people tout for not getting flu vaccines, is because they're like, well, I got the flu anyway. Well, yeah, you got the flu maybe, but that doesn't, first of all, to back up, there are several strains of viruses for COVID, not only for COVID, but also for flu. I just heard like yesterday or today that there's actually another strain that is starting to kind of rear its ugly head in, I think in Europe somewhere or something, but we have not yet, I don't believe, seen it here. And I don't really know much else about that. But viruses are smart. There are multiple strains. There are multiple strains of flu. Flu changes itself all the time, which is why we have to get a new vaccine every year. And so viruses get really smart. And so the flu strain that you get exposed to might not be one of the strains that was covered in the vaccine, because it wasn't one of the more common ones that we thought we were going to see this season. Or even if it was, okay, but hopefully again, you're at home on the couch, taking some Tylenol or Motrin and drinking some fluids. You're not in the hospital where you could die from flu. And again, I always point out that the last time we had a pandemic was Spanish flu. And more people now have died in this country from COVID-19 than Spanish flu. And we actually have modern medicine. So it's a real thing. People are still dealing with it. And to Lailah's point, we even have at our center a long haul, like a chronic COVID clinic, because people are coming up with symptoms and things that can't really otherwise be explained, except for the fact that they previously had COVID and now they're dealing with other chronic symptoms. So maybe you're also not that sick. If you weren't vaccinated, maybe you don't get so sick if you do get exposed to COVID. But that doesn't mean, we don't know that you're not going to have any chronic or long-term complications or something come up down the road. This is just the single best. It's one of the single best inventions still by far in medicine. And it's still the best thing that we have right now to help prevent infections. And again, I would just like to, yes, it is your personal decision to vaccinate or not, but I would like people to think about the person to the right or the left of them. And We can only get rid of this if we're able to suppress the virus enough. And to do that, we have to keep it from circulating. And to be able to keep it from circulating, we've got to get more people vaccinated, or we're going to just continue to be in this kind of circle of.
I thank you. I thank you for, and you kept it you didn't get too technical for us. You kept it there. But no, just to highlight your point. I mean, there was something that I talk about how, like, because I host Ask the Black Doctor, a lot of times I'll see medical stuff, I'll kind of highlight it. And one of the things I saw actually yesterday was a story that came out of Washington, D.C. that says nearly every person who died of COVID-19 in D.C. since June was a Black resident. That although Black residents only make up 40% of the population of DC, we make up 77% of the deaths. And so, like you said, a lot of that has to do with some of those other things that we're dealing with as Black people. And so it's just to highlight, like, the importance of if there's something out there that will allow you to not die, it's something that we should really begin to look into, particularly as we hit the 700,000 mark. And we don't want to see that continue to go up. So thank you for that. I have a question for you, Dr. Lailah, just on COVID again, right? Because we're back to like high school and children's, when I remember COVID happened, my son was playing soccer, he was swimming, and he was doing karate, and all that got shut down. It was just like, bro, you at home on this video game, and that was it, But now it's like, it looks like we're back, but we haven't had, there isn't a youth vaccine as of yet, right? I think it's 16. Is it 12 to 16? Can you get the vaccine during that age?
It's 12.
Right.
12 and up can now get the Pfizer vaccine.
Got you. So it's not a lot. So we're kind of reintroducing sports. And as a parent, you want your child in sports. I mean, for me, I want my child to be healthy. I want him running around. I want him to get all that energy out before you come home. So how can we keep our children safe, knowing that, like, unlike professional sports, right, the vaccine, people aren't vaccinated as much. Vaccines aren't available for anybody under 12 so far. So what are some tips that we can give the parents, like, as our children are going and reintroducing sports to be safe and to be healthy?
From the parent perspective, I am not a parent, but I recommend this because your children at certain ages will not be making adult decisions from some things. So one thing, if your child is sick, and whether you're vaccinated or not, I alluded to this before, it's hard to miss stuff sometimes. And of course the kids will be sad or something, but if whomever your child has been sick and not vaccinated, but has been sick for whatever reason for 3 days before going on an away AAU basketball tournament that people are going to stay overnight for, it's not wise to put them in that situation. COVID or not, might I say, but particularly COVID for that. Sometimes we can, find ways to get away with some things, but you just have to be mindful of that. If we're going around putting each other around others that don't even have the opportunity to get vaccinated, whether from sickness, illness, severe reaction to vaccine before, some other reason where people don't have a choice per se to get vaccinated or not. Those who do, being mindful and making proper decisions about putting whomever, yourself, your kid, whomever, around those people, because they don't have a choice. They're not necessarily, maybe they would decide, I don't want it, but that's not even an option if it's not for them. So that would be helpful for us to not do that. So one, I would just say, symptom check with your kid. And yeah, kids may not tell the truth, or they may say, no, I'm not coughing, and coughing up along those things, but have them go see their doctor, or be mindful of that. Or maybe they are vaccinated just over 12 and they're having symptoms, may need to wear a mask longer. It's hard for kids to wear a mask. So that's one thing. I think just be honest with self, with family. Is this the best for for someone else to. Yes, is this the best for my family, but is this the best for the people I'm going to be putting around? When you're traveling, when you're doing things, you're not only putting you and your teammates at risk, but then the other opponents, a whole group of opponents, a whole tournament, their family, and grandma was watching whomever for the first time ever, but she's there, but now whomever from across the state came and was whatever. We can come up with scenarios, but I think just being responsible for that and kind of policing self on that for sure. Sorry, I went long on that point just because I just see sometimes whether you're deciding to get vaccinated or not, just be mindful of other people and not saying, okay, well, I'm not vaccinated. I'm also anti-mask. I'm also anti seclusion. Like I want to be around people. I want to wear my mask and I don't want to get vaccinated. All of those are pretty inconsiderate, and just trying to think of, you have the choice of those, but being around others is not so much when it comes to your kids too. And then lastly, I'll just say when being in school, especially that school age of people, and then they're going to school. So there may be sports, or if you're on a team or a club team, not even the school there, we're fine, but then came back from a travel whatever, and an adult or who was sick and has symptoms, but then you're fine, you're coming back to school, where now we're in a whole school. It's just, that's how it spread. So just really asking and checking in with self and with family. And then if someone is on the team sick too, we're not saying go snitch, hey, whatever, but just have that conversation with each other and be, care about somebody else's health too. If you're not going to care about yours, and care about somebody else's health, please care about yours. But if you're not, then just in that way. So sorry, I think I only gave you 1 point because that's something.
But I think it's
important to me.
It's a great point, because I think you probably want to play that game, it takes another set of responsibilities. Actually more mature to say, I'm sick, I have to sit out. I know this might be a big game, but I don't want to infect. Like, that's a strong person to do that. And, I know, just like you said, we're talking about kids sports, the NFL, the NBA, they have to get tested before they can even get on the court. They're
also making money. So.
Of course, but you can't even go out there, they know. But I know in Pittsburgh, we have a place called Med Express that they can give you a rapid test. It's okay even to say, let me go check. I can go to Med Express, if you're insured, it's free, and they'll give you a rapid test. But that does take another level of maturity to say, yeah, I might want to play this game, but I'm feeling a little sick, or I came in contact with somebody that may have had COVID, and so that is a level. And, unfortunately, we aren't seeing a lot of in some cases, we aren't seeing a lot of maturity. And so, in order for us to get to where we need to go, hey, what you want to do personally is your decision. But if you feel sick, this ain't the season to be the I'm sick, but I'm gonna go to work anyway. Nah, this is a season to say, let me get tested, and maybe I should stay at home because I don't want to get everybody infected. And it's just a different way. I come from the era of sick, hell, rain, sleet, snow, I'm going to work. That was just how my mom did it. That's kind of mentality I have, but we got to get out of that mentality today because we don't want to affect everybody. So I think you made a great point.
And that's what I was actually going to talk about, is that, I think we just, and it depends on where you work, but certainly in medicine, the culture, which is so bad to say because it's medicine, but the culture really is you almost are not calling off ever unless you can't reliably walk through the door, or if you're actively vomiting or have a fever maybe, but for otherwise you're pretty much coming in. And so, yes, I agree. This is not the time. This is not one of those things where we need to be a hero and go in. We've now recognized there are a lot of things we can do from home. We do not need to necessarily be there. And yes, we might miss some things, but you know what? It's missing things now, and hopefully get this shut down in the next 6 months to a year, hopefully. And be able to get back to a little more normalcy than we have now, versus we're going to continue to deal with this for like, years and years. So I don't know if that's me. Oh, there we go. Oh, it's probably
Yeah.
It's a tornado warning. That was my phone. It was a tornado.
I was like, that's my emergency alert.
A tornado warning. Lord have mercy.
Yeah.
As if we didn't have enough.
Right. I have one more thing.
So, but yeah, so that's what I would say. Like, yeah, just stay home, get checked if you can. If it's within enough time, maybe, you can go back to that practice or that game. Then I would also say, now we're in fall where most of our sports have been outside. We're heading into winter where our sports are going to be inside. As much as you can, I think when you're not actively playing, even if you're playing, you could wear your mask. But if you're not actively in and you're sitting on a bench, you're sitting at practice, you're sitting in the stands watching somebody, have a mask on. That's the best thing we can do, is just try to keep from spreading COVID, spreading flu, both of them together. It's going to be interesting. I really hope that we can keep things under control between COVID and flu, because together they're not going to be great. The other thing I will say is that hopefully within this next week, we will know whether or not Pfizer will be approved for ages 5 and up. And so hopefully we will be able to vaccinate kids 5 and up and get more control of the COVID situation in general, but also having our younger children protected as well, because they're in school and a big part of who's out in the community from day to day. So hopefully that'll be happening soon. And I would also echo that, yes, not everybody has the choice to decide whether or not they could or could not get vaccinated. And even if they chose to get vaccinated, they still don't have, it's not their choice that they may have an immunocompromising condition. So they're still potentially at risk. And, they may take all the precautions that they can, but it's nice to have people around you that will also take precautions to help keep you safe. So just to keep that in mind.
No, those are excellent points, great points, and I appreciate you sharing. So it's a couple questions in here. I'm gonna come to you, Dr. Erin, and then let's get into those questions. I see one of your Jamie Baxter, who said you're their children's dentist, and congrats to Jamie. And Jamie was just named executive director of Allies for Children. So congrats to Jamie and the great work. Yes, that she's doing and will continue to do. So, I know that there was a point where, we shut everything down, and with still COVID, it's still, I know certain people are avoiding hospitals because of that, or emergency rooms because of that. Is it safe to come back to the dentist? The dentist is going to be all in your mouth. People, spitting everywhere. Is it safe to come back to the dentist now? And what are the precautions that folks should take going to the dentist? There are precautions you all are taking. How are we keeping folks safe at the dentist during COVID?
Yeah, so the short answer is yes, go to the dentist. The long answer is that, so if you remember back when things first started, at least in Pennsylvania, we couldn't do anything for a week there. It was dentist, not emergency care, not anything, unless you had this specific type of room, which is only located at hospitals, and not even all the hospitals have them. But then, so many dentists complain, so many people complain, what am I supposed to do if I have a dental issue? That got changed. But I think they realized that, oh shoot, this is an important thing. Teeth are not separate from the rest of your body. Your health is your health. If something's wrong in your mouth, it's wrong in something's probably going on in the rest of your body too. So the biggest thing I can say is if you haven't been back to the dentist since all this started, you need to be back there like yesterday. The number, we are so busy because people are still trying to catch up from 2019, 2020. But then also because people were so delayed in coming, not necessarily their fault, but there's a lot more cavities. There's a lot more just stuff happening. Like our schedule is so busy. So even if you feel like I still might feel a little iffy about going, call and make an appointment because chances are you're probably not going to get in for a few months anyway. So that's number one. Number two, precautions that we're taking. I know for my office, we're still wearing level 3 mask and a face shield when we're doing cleanings and things like that. For procedures, I'm wearing a N95, a mask, a regular mask over top of that, and my shield. So honestly, more of the threat of getting COVID is for us as providers in dentistry rather than the patient, because they're the one whose spit is flying, places. But we also control that by using, the suction, and we have all kinds of things that we can use to make sure that it doesn't fly all over the place. Also, the way at least my office is spaced out, there's plenty of room in between each chair. We're still only allowing, whether they like it or not, Jamie can speak to it, but we're still allowing just one parent in with the kids, unless it's like a family of 4, then maybe we might allow 2 parents, but just one parent, not bringing your neighbor, your niece, your grandma, everyone to the appointment. As much as it's fun to do that, we're really limiting who comes in to each appointment. We're still having people text us when they arrive, when they're parked, and we'll let them know when we're ready for them so they can come in instead of just everyone piling in. It's still a law in Pennsylvania that you have to wear a mask in a healthcare facility. So everyone's still wearing masks, everyone chewing up. And I will tell you, the little toddlers are the best at wearing masks. They are amazing at wearing masks. I'm going to throw this out there, but if all adults would be on board like these 2-year-olds are, we could have been done with COVID a year ago. So just FYI.
Wow.
Seriously, they're great because they're like, okay, well, this is what I have to wear. So I'm wearing it. And they actually will ask their parents, like as soon as they're done with us cleaning their teeth, they'll say, "Mommy, mask," and they just put it right back on. It's not that big of a deal. But so that's what we're doing at my office. I'm not sure. We also do hand sanitizer at the door, which I think we're going to do forever because it's just kids coming in from daycare and school, and there's just stuff everywhere. So, but we also do for the parents too. So that helps a lot. Those are the things that we're doing. I'm not sure what everyone else is doing, but you can always, when you're making that appointment, call and ask them, what precautions are you guys taking? How are you keeping us safe? I will say that the longer you delay, the worse it's going to be. And one of the biggest things that people don't like about going to the dentist is that, I'm going to have to get 18 cavities filled. Well, if you wait 4 years, it's going to be not very good. So call ASAP and get on it there.
Yes. Get on that list. No, thank you very much. So now we only have like 10 minutes left. I know it time fly by, but I do want to, answer, we have a couple questions where I think this is really important. Can someone talk about boosters? So I want to come to you, Veronica, about boosters, because I know people are getting boosters. I think recently read that they were saying the booster doesn't have to be the vaccine that you got initially, that you could maybe have got the Pfizer, but get another booster. So can you just talk about, how boosters work, why folks should get boosters, and if I got Johnson & Johnson, is it gonna, the Pfizer booster, is that gonna mess me up, or what's going on? Can you just talk a little bit about that?
Yeah, and I think that's the 2 questions that were up there, so that's great.
Right.
So so yes, you can now mix the different vaccines. That is safe and okay to do. And I believe, I don't know if it's totally mandated, but I was hearing information about if you did get a Johnson & Johnson vaccine, then likely you should be getting a booster with, you can get it, at least what I heard was can get it with Moderna. And it's actually, I think the study looked at a half a dose because that actually was enough for a booster dose for Moderna. So if you did get a Johnson & Johnson vaccine, I would just check with your provider and see if you do need to get a booster. I will say for at least initially when we started talking about needing booster doses, with first it was the Pfizer vaccine and needing boosters for anybody that I believe is 65 and older, or if you have live or work in a healthcare setting, or if you have some other immunocompromisation, then you should be getting a booster shot 6 months after your last dose. And again, I would just contact your provider and ask them if you fit in that category. I don't know that we've totally gotten to where everybody is mandated to get a booster yet, but that might be where we're headed. And then I think similarly with, I think there is some data and some literature about that with Moderna, but again, I don't know that that's completely 100% yet. And it mostly is just, the last thing I heard from Moderna was similar to Pfizer, is that if you're 65 or older, if you have a high risk or in a high risk category, or you work in healthcare setting, then you should consider getting a booster dose. And the reason the booster helps is because over time, the amount of antibodies that your body has made and are available are start to wane over time. And so if we get a booster dose, that helps our body create more antibodies and have enough fighter cells to go fight if you would get exposed to COVID. So that's the importance about getting booster doses. The other thing I would say is sort of tagged on to what Erin was saying is not only for the dentist, but also for health in general, it is safe to go back to your doctor, back to the emergency room. It is actually more risky for you not to, because again, if we're delaying on getting the care that you need for chronic conditions, when you present, or if you present in a situation where you could be sick, whether it's with COVID or something else, your body is at a disadvantage already, and your immune system is going to have to really try to work overtime to help you get through it. And so the best thing we can do for ourselves is keep ourselves healthy. And that means making sure we're on top of all of our medical conditions from head to toe, taking your medications, making sure you have your visits. And a lot of the things right now, again, talking to your doctor, because I mean, I see a lot of things virtually now. So you don't have to necessarily come in, but you need to be talking with a provider to make sure that, hey, if this one symptom has been happening and this is new, do I need to worry about this condition? Does that mean I need to get some other testing done or whatever? And the best thing we can do for ourselves is to stay healthy. Also to that end, because I hear this come out sometimes, is that, oh, well, I eat well, I'm healthy, I eat organic, I exercise all the time. So if I get COVID, I'm not gonna get sick, right? COVID cares not if you eat organic, if you are exercising like a fiend. It cares no way, no how. It knows nothing about any of that. Yes, if you're healthy and otherwise your body is healthy, then yeah, you probably do have a good chance to not have as much risk or be able to fight off an infection. but that doesn't mean that you aren't at risk for being as sick either. We
Right.
still don't exactly know who might get the worst of COVID sometimes. We do have high risk categories, but someone else who's perfectly healthy can get really, really sick.
Right.
So the best thing you can do is utilize the information that that's out there. Getting vaccinated, wearing your mask, still washing your hands, still social
Right.
distancing. I mean, yes, we've kind of gotten back into some things in our life, but still we need to take those precautions. We were at Disney World, and we are big Disney World people, and all of us had our masks on almost all of the time. And especially when we were outside, but we were standing in a crowd of people watching fireworks. All of us had our masks on because we all work in healthcare. We have people with that are on immunosuppressive medications in our family. The more precautions you can take to not get it in the first place, the better. So we still need to be mindful about doing those things.
Yeah, I mean, there's super more questions. Unfortunately, we've run out of time. We got to do part 3. We got to do the Issacs part 3 for the 3 sisters. But we
have to get the OG on next time.
Yes. Yeah. I have not talked to the OG. I agree with that. But also definitely want to let people know about this Saturday is the virtual scholarship gala from Gateway Medical Society. I'm gonna put the Eventbrite in the chat. We're asking folks to come to this virtual gala, support the Gateway Medical Society. There's the Eventbrite. And, of course, I'm biased because I'm getting a Community Champion Award. I'm humbled by it. Thank you, Gateway Medical Society. Also, and with Lynn Hayes Freeland, like a legendary Pittsburgh, who she just retired. So she's super incredible, as well as Dr. Stephanie Miller is the rising star. She's been on the show a number of times.
You have a former rising star right here, Dr. Erin Issac.
Oh, see, look at all these rising stars and incredible. Y'all got all the awards. But so please support Gateway Medical Society this Saturday. There's still time to purchase tickets. There's still time to help. And then I think Dr. Johnson got like a community person of the year, I think, from Omega Psi Phi. What did they say? Citizen of the year. So congrats to Dr. Johnson and shout out to Omega Psi Phi fraternity for honoring her work and the work of Gateway Medical Society. So please continue to help support this work. We appreciate having you all on as well. And, I think you said it best. At the end of the day, it's still a global pandemic. I know some of us have fatigue, but hey, look, keep your mask going, keep social distancing, keep using the sanitizer and all of that. And stay safe and stay healthy. So thank you all. Until next time, we'll see y'all back next month for Ask a Black Doctor. Actually, we'll see you this Saturday at the virtual gala. We'll see you then. Peace, y'all.
Bye.
Bye.